Are you confused about the types of Medicare plans and what are the differences between them? Well, you're not alone. Stick around and I'll be showing you what you need to know. Hi, I'm Shawneen Sullivan, founder of USA Medicare Plan, where we help people on Medicare find low-cost options for Medicare supplement and prescription drug coverage. Today I'm going to talk about the types of Medicare plans. Part of the confusion among people turning age 65 or that are new to Medicare is that you're getting bombarded with so much marketing, whether it's mail or phone calls. It's just information overload. It's tough to know where to begin. There are so many different plans and insurance companies, but first you need to know that there are two types of plans: Medicare Supplement, also known as Medigap, and Medicare Advantage. Once you know which type of plan you prefer, then you can look further into the specific plans under that category type to narrow your choices down to one or two plan options that should work fine for you. So once you've narrowed it down, it's easy to choose one just by answering a few questions related to your specific medical needs and your lifestyle. Medicare is a government program for people over the age of 65 and with certain disabilities. There are parts of Medicare and plans of Medicare. The four parts of Medicare are Part A, Part B, Part C, and Part D. I'll explain these parts briefly, and this will give you a better understanding when we talk about the types of Medicare plans. Part A is inpatient coverage when you're in the hospital. It includes your room and inpatient hospital care. It also covers skilled nursing facility stays, hospice, and home health care. There's a deductible associated with Part A, and that can change every year. For most people, there is no cost for Part A. If you worked at least 40 quarters in your lifetime and paid taxes, then your Part A is considered paid up and you'll pay zero. Part B of Medicare covers outpatient medical such as doctor visits, lab work, tests, surgeries, durable medical equipment, and preventive services. You must sign up for Part B and pay a monthly premium. Certain people with lower incomes may qualify for assistance that covers the Part B premium for them. The cost for Part B can change every year. Part C is called Medicare Advantage, which are privately run health insurance plans. This is a bundled all-in-one type of plan that includes Part A, Part B, and most of the time Part D into one plan. Part D is prescription drug coverage. These plans help cover the cost of medications, including shots and vaccines. Part D plans are also run by private insurance companies, but are still regulated by the government. You know, Medicare is great coverage that you paid into your whole life, but it does have gaps and holes. Medicare pays up to 80% of your medical costs, and you're responsible for the remaining 20%. This 20% is an unlimited amount with no cap on how much you could be billed for. It's a lot of risk you'd be taking if you only have Medicare Part A and Part B without any kind of supplement. You have two options for your Medicare supplemental coverage. The first option is to stay with original Medicare Part A and B and add a Medicare supplement, also known as a Medigap plan, and add a Part D drug plan. The great thing about Medicare supplement plans is that there are no networks. You can see any doctor nationwide that accepts Medicare. You also have coverage if you travel outside the U.S. Medicare supplements help fill in the gaps and holes of Medicare. They pay the deductibles and the coinsurance that Medicare Part A and Part B don't cover. There are 10 different plans that are lettered A through N, which we'll cover in more detail in another video. They don't include Part D prescription drug coverage. You'll need to purchase a prescription drug plan in addition to your Medicare supplement plan. The second type of plan, and an alternative to Medicare supplement, is called Medicare Advantage. This is a bundled type of plan where you'll still need to have Part A and Part B, but you don't need to buy a separate Medicare supplement plan or a separate drug plan. You'll still need to keep paying for your Part B no matter which type of plan you choose, Medicare Supplement or Medicare Advantage. Medicare Advantage, also known as Part C of Medicare, has Parts A and B and D combined. There are 6 different types of Medicare Advantage plans. These are network type plans, the most popular being HMOs and PPOs. These plans are similar to the coverage you've always had through an employer when you're working and under age 65. With a PPO, you can see doctors and providers in the network and out of the network. If you go out of the network, then you'll typically pay more for the services. And with a PPO, you won't need a referral to see a specialist. With HMO, the plan pays for care received inside the plan's network. And if you go out of the network, you'll pay 100% out of pocket. Also, with some HMOs, you'll need a referral to see a specialist. There can be out-of-pocket costs with Medicare Advantage. That'll be in the form of copays or a coinsurance percentage that you'll pay for your medical care. There's an annual maximum out-of-pocket on each plan that puts a cap on the total amount you can be billed annually. Most Medicare Advantage plans include Part D prescription drug coverage, and sometimes there's extra benefits included in the plan, such as dental, vision, health and wellness products, and gym memberships. Sometimes you may be able to find a Medicare Advantage plan that has a $0 premium. It's important for you to know that benefits can vary from plan to plan and also by the county where you live, so not all types of plans may be available in your area. This is something that we can help you with. We have access to all the plan options in your area. So how do you choose which plan is best for you? Well, that depends on a few things. Some good questions to ask yourself would be, do you want the freedom to choose your own doctors? Or maybe you don't mind staying within a network of doctors and hospitals. Do you travel outside of your area? Some plans will only cover you on an emergency basis if you're out of the network area. Is it going to be affordable? Would you rather keep your monthly premiums lower and then pay as you go for services? Or would you rather pay a higher amount each month but have peace of mind knowing that you're going to be covered no matter what, while having a predictable cost every month? I hope this video has helped you better understand the 2 types of Medicare plans that are Medicare Supplement and Medicare Advantage. If you have any questions, please call or email us. Our service is 100% free and we're happy to help you. If you like this video, please give it a thumbs up and be sure to watch our other videos to help you better understand your Medicare.